you help coordinate that, and then if you add Alzheimer's on top of whatever the other medical problems are, it becomes infinitely complicated. Somehow we have to build into the system a methodology to pay the physicians to take the time and talk to the patients. I think for some physicians there may be an education component. They may have to learn more before they can communicate it. But if we pay them to take the time to talk to the patients, I think they will at least give them the information and point them in a better direction. Do you want the microphone?
Part of the problem is a lot of doctors are penalized now if they talk to patients. They're only given, what.
And that's what we have to change. I mean, there are all these billing codes. There needs to be a billing code that says consulting with patient. Well, they're constrained in how much time they have, and they're paid so little they've got to maximize the number of patients. That's what happens.
The mention of stigma attached to Alzheimer's, maybe I'm clueless in the sense of can't understand why people would have such an attitude about a stigma attached to Alzheimer's. As far as we know, Alzheimer's is not contagious, and as far as we know, Alzheimer's does not necessarily have a contributing factor or behavior that leads to Alzheimer's. We've had diseases, and I'm not trying to pick on any diseases, but AIDS, when it first became headline news, there was a certain behavior that was attached to developing AIDS. Cancer, particularly lung cancer, there's behavior that contributes to cancer. And so I have some very uncomfortable feelings about people wanting to attach a stigma to Alzheimer's. But one of the other things I think that speaks loudly is to the drug companies. I am a pharmacist, and I know all too well the cost of the AIDS cocktails or HIV cocktails that patients get to avoid falling into the pitfalls of AIDS. The cost of Alzheimer's medications is nowhere near that of what it takes to provide a person with the antiviral drugs to avoid the symptoms of AIDS. So I think somehow we need to bring attention to the fact that it's a lot more cost effective if people, first of all, if the insurance companies realize what it's going to cost in terms of human sacrifice and cost of jobs lost and work time lost. So I think if that money factor can be brought out, maybe some of the stigma attached to Alzheimer's can start to abate, and people start being realistic about the condition.
Just a very quick comment. We're not going to reform the healthcare system tonight, but I think it's important that we realize it needs to be reformed. And one of the very important issues is the reimbursement system. We now have a system that reimburses physicians based on a diagnosis and a procedure. We have to move to a system that reimburses the system based on their care of a disease universe, not individual patients. And that's the only way we're going to get the cost down and get the services distributed appropriately. That may take another 20 years, but I think we need to begin to look at that, because this system will never do that.
Neil Golly, I'm a new board member, and I own a home care company, so I'm obviously an enormous proponent for the respite type programs and being able to go on a daily basis, physically see the relief that we can provide to a caregiver and the support so that they can go out and shop or do whatever it may be for a few hours. But one of the waves that's coming right now, and it comes to part of the problems with the cuts in Medicare and Medicaid is, and you see it all throughout Northeast Ohio right now, nursing homes as a whole, they're getting rid of their long-term beds. They're shifting all over to short-term rehab beds, which kind of pushes that shift back to the home care, which is great. But the reality is that long-term Alzheimer's dementia care is significantly more expensive because of the additional training of staff and caregivers, knowing the disease, the ins and the outs, being able to have a physical secured facility as well. So the reality, we're going to lose more of those long-term Alzheimer's secured rooms and beds as well, with the way in which money is being allocated and budgeted for those things. So we're going to have even a greater shortage of space to be able to house and adequately care for people. You're seeing the private sector step up a little bit more with increased Alzheimer's dementia specific memory care assisted living communities, but it's not going to go far enough. So I really, the research is crucially important. The respite programs are crucially important, but you've also got to look at what the next steps are beyond that. And going back to like the adult daycare programs, they're fantastic, but that's actually that's a Medicaid type of fix almost, because it's a long-term, it's kind of a Medicaid waiver program almost, to where it's the only way that you can go back in and pay for on a long-term, a daily program, a respite program for an individual. So I don't know where that kind of ties back in, but thought process, it needs to go that direction.
I think Medicare and Medicaid have definitely worked as a health care insurance for older adults and for those with limited resources. Because we all realize and recognize that before either of these two programs, more than half of older adults had no comprehensive insurance. And so when we talk about the cost of treatment, and you begin to take away benefits or opportunities for individuals to have full Medicare or Medicaid benefits, then you're going to further set back the treatment of Alzheimer's disease, because it doesn't hurt. So people are not going to go to the doctor when you have no money. Unless there is pain and suffering, you don't go to the doctor. So Alzheimer's disease does not come, especially in earlier stages, not until it is severe with pain associated. So we're going to delay treatment if we don't have adequate coverage. So as we look, and this is really good time to talk about the Deficit Reduction Super Committee. As these individuals begin to look at how they can reduce the deficit by an additional $1.2 trillion, as advocates, we must be vigilant. Because when they begin to talk about cutting Medicare and Medicaid, they are also talking about cutting treatment for Alzheimer's disease. And we can't let that happen.
I'll let this be my last comment. But, and I like to turn my back to the camera, but I like to talk to people. When you ask about government programs, one of the things I think that's going to be very important is that there should be some protection of persons' jobs once they have Alzheimer's, until they are in a state where they really cannot function. But I think in early onset with some people, they're still capable of holding down jobs and need jobs in order to be able to afford insurance to keep themselves going. And we have some protection now for people who have developed other diseases, and they can't be fired because they have cancer. They can't be fired because they have AIDS. And I think somewhere in our government policies, there needs to be something that will apply the same equity to people with Alzheimer's, and that is, you cannot be fired simply because you now have Alzheimer's, and at any time, and that's going to be difficult, but I think it's going to be necessary.
Conversely, you have to recognize when you can't work because of Alzheimer's.
Yeah.
Because when you're young and you can't work, you don't have anything. You have your 401ks to put away, to just live on. You have nothing. I don't have Medicare. I don't have Medicaid. I have 1 month of Cigna left. It costs me 1/3 of my monthly income to pay for my insurance right now. It costs me 1/3 of my monthly income to pay for my medication right now. And the other 1/3 is for every single thing else. There has to be something made available to younger people who have something catastrophic. And one thing I do want to say that no one said tonight is that the end of Alzheimer's starts with me.
Hi, yes. My father's fallen prey to a lot of financial scams, both a lot of sweepstakes, a lot of I don't even know if they're legitimate, but political campaigning. I'm just glad I never got him on the internet. It's mostly through phone and, through mail now. He can't hear that well. And when it first started, I contacted both the postmaster and the attorney general, and I was just completely, they just laughed at me. And the problem's getting worse, and it's now not just cash and checks, but it's credit card numbers. And it's a really big concern of mine that this is going to really rifle out of control with him. And we haven't really gotten power of attorney, so we can't deal with it yet. So it's a problem.
One of the areas that has come up in our support group again and again is the area of need for legal advice. Help. What do we do now? What do we do as far as power of attorney? What do we do as far as how do we protect? How do we get the care that we need? How do we get our questions answered? Medicaid, what are the limitations? How do we save what we do have so that we have the adequate resources for the funding that we need to care for and keep on going? One of the members of our support group right now is struggling so badly with the need to provide for her husband, but she has to work full time. She's a bit younger, and she doesn't qualify herself for any of the Social Security or Medicare funding, but yet she is supporting her husband, who is a little bit older and is definitely in need of this of a lot of caregiving. She doesn't have the resources. Where does she get it? How does she look for getting the legal help and advice she needs to just go on a day-to-day basis of finding even such things as housing or ongoing planning for food, this kind of thing? The Legal Aid Society is a tremendous help in our communities. I think we need a lot more of it.
You asked about, I think, government programs, and Medicaid, which is certainly a government program. Just this year, the state of Ohio has decreased the amount that it pays nursing homes for the reimbursement for Medicaid patients. And I don't have the statistics, but my understanding is a very high percentage of the people in nursing homes have Alzheimer's or some form of dementia. And if you have money when you go in, it doesn't take very long to spend that money down and wind up on Medicaid. And to the extent that we're cutting the money to the nursing homes, we have to at some point start to affect the care of the Alzheimer patients. And I think that needs to be something we have to be cognizant of and aware of and stay on top of.
Working up the energy here. Today is my dad's birthday, first one that I've celebrated without him. And I agree with everything that's been said as far as awareness and education. The experience we went through, definitely I had no idea what to expect with Alzheimer's and how to support my dad. And my sister didn't, who was the caregiver, and look back and regret a lot of things and wish we could have done a lot of things differently. He lost the battle this year 2 days before my son was born. So, never had the chance to tell him a lot of things that I wish I could. But my dad was a school teacher, perfect attendance for 40 years. And maybe I'd like to address a couple of the things that came up here and that I feel are important in the National Alzheimer's Project Act. We talk about the stigma. My dad was a very proud man, and when he was diagnosed, he didn't tell anyone. He was probably embarrassed, and for when he did know, probably was scared about what he was about to face, and thought, boy, people are not going to treat me the same, and in fact, they didn't. So all of these plans need to be connected. The research, the public awareness, the education, it all needs to be connected to hope. Hope for the caregiver, hope for the person that's diagnosed. Because what good is it to know all this and then, let me tell you, know what you're about to face? Because it's pretty scary. And no one wants to watch it, and no one wants to go through it. So I know the research obviously would be one of my highest priorities because, again, no one wants to face this. And a coordinated research plan that really makes people think we have the best people on it, the best doctors that are working together for the best possible cure is something I'd really like to see coordinated in the plan.